The different areas we look at attention, mental processing speed. Attention is almost always affected. It's, if there's any kind of insult to the brain, any kind of neurological problem, except for Alzheimer's disease. Alzheimer's disease, the attention is usually pretty well preserved. Processing speed, sustaining your attention, sometimes what we call selective attention. Often you'll find someone has a hard time tuning out the distracting other information in a room. So that we look at all those different aspects of attention. We look at memory. We look at visual memory, verbal memory. We look at memory, recalling something right away, immediately, and then we'll wait a half hour and then have you recall it again to get a general idea of how the memory functioning is. And again, you look at those patterns. Sometimes something on the injury to the left side of the brain, you're going to see the auditory memory affected, but visual memory is fine. And the vice versa is true. If there's injury to the right side of the brain, often the verbal skills are fine and the verbal memory is fine, but there are deficits to visual spatial skills and to visual memory, which would explain some of the problems you might be seeing that the person might be experiencing. So our test will pick that up. We look at our language skills, which might be including identifying pictures, so if they can name, how quickly they can name. It looks at fluency, repeating words, things, and listening to commands. We look at the visual spatial skills, which might be how well they can copy a drawing, if they can look at different arrows and figure out where they're pointing, to see how that whole area of the brain, which is more of a right brain type of skill, how they're able to do that piece. And sensory motor. Often, depending again which area of the brain, could be the parietal area, sometimes your sensations are affected. So we look at how well you can differentiate two different touches. Sometimes you can, if I touch your left hand, you can feel it. If I touch your right hand, you can feel it. But if I touch both, if one area of the brain is affected, you won't feel that side that's affected. And don't forget, the left side of the brain perceives the right side of the body, and the right side of the brain perceives the left side of the body. And reasoning skills, the higher level reasoning skills. This is, again, because reasoning now is putting it all together, all the different other areas of the brain together, often that's impacted. And that can be very frustrating when someone knows they're right, they think they're right, but they're not getting all the pieces together. And that can cause some conflict in the family and some conflict in the rehab center when they don't understand why they're being asked to do what they're being asked to do. And executive functioning. Everyone heard of that term before, executive functioning? Is that a pretty common term? If not, basically, the way the brain works is you can think about a bunch of programs running the brain. Something happens in the world and the brain just starts to do its thing. Most things we do are unconscious. We don't think about it. But we all have that little person in the brain that's aware of what we're thinking, aware of what we're doing. And it can think of what our plan was, what we're trying to accomplish and what happened in the past. And it can stop and start programs. It can plan. It can organize. It has that awareness. With executive functioning impairments, that's lost. And that could also be a very frustrating thing. It's almost like the person's constantly in the moment, constantly just doing whatever comes to mind and not realizing they're even doing it. All right, let's see what we got here. With our, I got 20 minutes, right? I just want to make sure I'm get through this real quick. All right, there's different ways that a neuropsychologist will figure out what's going on in the brain. Because our concern is what is the brain able to do and tease out what's because of emotions, what's personality, and what's because of the brain injury itself. So one thing we can do, like I said, we can look at the level of impairment. We can say this person's memory is in the above average range. They're better than 84% of the people their age. Or this person's visual memory is only better than 1%. It's a severely impaired range. 99% of the people are doing better. So we get an exact idea of where that area is functioning. But we also are very interested in the pattern of impairment, because different types of injuries will cause different patterns. When someone's depressed and they're not remembering, there's something called pseudodementia, where you're just so depressed, you're forgetful, you're not focusing, and that has a very different pattern than someone who has dementia. We can tease those things out, or an injury because of a tumor or any other, a stroke or something like that. So the pattern impairment helps us figure out what's going on. We look at left-right differences. Like I said, the left brain often is, it's language-based, verbal memory, logical, sequential, where the right brain is more holistic, intuitive, emotional, spatial. And there's certain signs that you could just see. So for example, we might have someone draw a clock and put the numbers in. And then if you see that the numbers are all shoved to the left side of the clock, then that usually gives a pretty good idea. There's something organic going on, usually with a neglect or something along those lines. My son did this, by the way. I like the little fancy way he did that. Okay. Let me go through this. I'm going to fly through this really fast, but I thought it might be useful to get an idea of understanding how the brain works. And this is Luria's theory of brain function, or cortical function. He was a Russian neurologist who came with this idea of how the brain is structured. And I think it's pretty useful when you're thinking about especially the brain and the different impacts that different injuries have to it, especially with brain tumors where it could be in a very particular area of the brain. So what he does is he breaks it down into 3 different units. And first unit is arousal and attention. And like I said when I first came in, if you're tired, fatigued, the medication is knocking you out, you just came through a surgery, you're not going to be very aroused. Often in the hospital, at Health South, if someone just came out of surgery and they're just not feeling good and they're tired, it's not that they have severe cognitive impairments. You don't know because you're just not able to focus or maintain their attention or have enough arousal to even do those higher level things. You have to let the body heal sometimes. And it's not depression either. It's not that they're resistant. It's just that they're under aroused and we got to get that, let that recover. So that would be the very first step, making sure their attention and their arousal is up to par. After that, we look at how well does the brain take information in and process it. So it's the input. That's your perception, your memory. And then, finally, we look at the output. What do we actually do with that information, the action, which is what we actually end up seeing. So all 3 of these pieces, when you're looking at any kind of problem functionally, it's going to have to do with one of these areas. All right. Now, I thought this might be interesting. What he then breaks down, the second 2 areas, the input and the output, is what he says is that there's different units. And basically the way the brain works is there's different areas of the brain. First what it does, it takes in specific features within an area. So it will take in visual information and just break down lines, shading, things along those lines. And then it will start to integrate within that area. So we'll start to get a picture, a visual picture. Or you might hear a sound, and first you'll just hear different aspects of the sound, start to integrate the sound. And in the third area, you start to integrate the sound with the tactile, with the visual, and that's where you get your whole picture, and then you put the meaning of what that means, and the brain integrates it all together. So what I did here is a little picture of the brain, and I also have, if you're interested, it's made some copies of that. I thought you might find interesting. But if you look up there, the brainstem, that's basic, your reptilian brain. That's just keeping your heart going, your basic arousal. The limbic system, that's more your mammalian brain. That's protective drive states, emotions, you're wanting to eat, want to have sex, all those things are in the limbic system. And then the newer part of the brain, which is probably the least control that you have up there, is the cortical areas. The occipital area in the back of the brain, that takes in the visual information. So you can get, if there have some damage there, you might have what they call agnosias, where you just don't recognize certain visual things. Your visual memory, visual association, spatial abilities. Next to that, you have your parietal area. Now that has to do with taking tactile information. So, and with tactile has a lot to do with your idea of your body in space. So spatial, it will then integrate to spatial information. So you can see there that that will affect your motor planning, speech, and just spatial information in general. Your temporal area, which is picking up sound, especially on the left side. So that has a lot to do, sound with language and auditory memory. Emotions are in there too. So this is very simplified, but it gives you a general idea of how the brain's organized when you're trying to figure out, hey, there's damage here, what might be affected. And the frontal part of the brain, that's the output part. That has a lot to do with the executive functioning, the judgment, the reasoning, anything you need to do to put all the input and figure out what you're going to do with it. So that's just a brief outline of how the brain works. So sometimes someone will come in to the hospital and we're picking up deficits that don't fit with where the damage was to the brain, and that gives an indication there might be something else going on. So that's why it's a good idea to know what parts of the brain do what and what might be affected. That being said, the brain is super complex, And it's never as neat as they say it is in any of these books and as that picture showed you. Personality testing, we want to look at the Beck Depression Inventory. These are some of the tests that we use. But basically, we want to assess for depression. We want to assess for anxiety. We want to, sometimes, the geriatric depression scale is for the elderly. They ask questions a little differently because some of the same symptoms of depression will manifest differently as you get older. We also have a test that I like to do is give one to the patient and one to the family, because it's very interesting sometimes to see how the person who has the injury perceives themselves versus how the family is perceiving them. You know, very often, like with Alzheimer's disease, you'll give one of these questionnaires and the person who has dementia says their memory's fine, but everyone else in the family says, no, the memory's not so fine. So it gives you some good information what's going on in the family, information and insight. And then we have our standard personality tests, and there's tons of them. The MMPI is one big one. And this is also very important. Someone is refusing therapy, let's say, and people say it's because maybe their reasoning ability is impaired or their insight's impaired. And sometimes it's just a personality quirk. Someone who's used to being in control their whole life, they're very type A, and all of a sudden they have a bunch of these young women telling them where they have to be, when they have to do it. They're not so happy about that, and they don't like someone taking control like that. So they're going to refuse, and you have to do things on their terms. And so understanding those parts of the personality are hugely important. All right, and as I was saying before, every once in a while there are some behavioral problems with irritability, refusals. There's situations where someone used to always ride their bike, and they were independent their whole life, and all of a sudden people are telling me he can't ride his bike. And he's like, I've been doing that for 60 years, what are you talking about? And he wants to go out and ride his bike. Another person hadn't smoked in years and years and forgot he hadn't smoked, and he was sneaking cigarettes again. So there's a lot of these behavioral problems that come up within the family that we want to address. So you got to look at the person themselves, the environment they're in, and how the brain has affected them, and put all those pieces together to come up with a plan.